PA, and then I'm going to do unilateral PA. So these are glides. Okay. The upglide and the downglide is going to be combined with motion. So when we do a downglide, so I'm going to use side bending right to look at the downglide. Okay. And then do upglides, it's going to be rotation. Okay. And let's talk about why. Okay.
Oh, I have a quick question before we.
So before you ask your question, I want you to be an inferior articular facet to my superior articular facet. So I want you to be 45 degrees.
It's like a plane.
Okay? So if you're an inferior facet.
Oh, okay,
You
okay,
follow
okay.
me.
Okay.
You're inferior. You're inferior. I like that. So 45 degrees, all right? So if I'm going to do forward bending, I'm the superior, so I'm C5, he's C6. Moving forward, C5, joint capsule's tight, now I take C6. Up and forward. If I do extension, down and back. Okay? If I do rotation, up and forward, down and back. If I do side bending to the left, down and back, upward, forward. Side bending and rotation occur in the same direction in the cervical spine, except for up here. We'll talk about that later. Okay? So when we do an upglide, I'm trying to look at the ability of this facet joint to upglide on this facet. The superior facet on the inferior articulating facet, right? So is this gliding up, and then the next segment, once this motion is gone, next segment, that is gone, next segment, next segment, right? And that's, so up glides, okay, are more associated with rotation. Understanding that side bending and rotation are both occurring, it's just easier to think about up glides with rotation of the neck and down glides with side bending of the neck, okay? But understanding that we're assessing if side bending and rotation are gonna occur in the same direction. Side bending left, right facet up and forward, left is down and back, okay? I'm going the opposite way, it's gonna be the opposite. Left up and forward, right down and back. We good? Okay. All right, so in order to do that, we need to be able to find the articular pillars. And we heard Dr. Ackland talk about the articular pillars in last class, right?
I broke it down.
So that's where all of your facet joints are stacked up. This is called the articular pillar, right? You identify them by bumps and valleys, bumps and valleys, bumps and valleys, okay?
Ask my
And
question.
so the valley is gonna be the articulating surface. Then you're gonna get a bump, then you get a valley. That's your articular pillars, okay? Today, what I want you to find is the articular pillars. I'm not worried about C5 and C6 now.
They're there.
I need you to find the articular pillars. And I need you to know that, oh, I think I'm somewhere in the upper cervical spine. I think I'm in the middle cervical spine. I think I'm in the lower, okay? So if we suspected somebody had a Dens fracture, what type of radiograph would we want?
Where?
What type of radiograph would we want?
X-ray.
What type?
X-ray.
What type?
Upper.
Open mouth. Open mouth. Right? That's spondylolisthesis, right? Open mouth radiograph will get you C1, C2. C3 is going to be your mandible. The hyoid's around C4, C5. Okay, so that can kind of give you a guideline where you are in the cervical spine. Make sense? Okay, so we'll talk more about upper cervical instabilities, all that stuff in a couple weeks. Okay, so today what you need to be able to find is the articular pillar, so the transverse process of the cervical vertebrae, and then the articular pillars. And I want you to be able to find them anteriorly, laterally, and posteriorly. Okay?
And just to confirm, this is mobility? This is like
This
the
is
mobility assessment?
Yep, mobility assessment. Yep. So it's the next thing on the on the handout. Okay? Because we already did the neuro stuff. Everybody good with that? Okay? God bless you.
Going through your mouth.
God bless you.
God bless you. All right, so is he in a neutral position?
Yes.
Looks pretty good to me.
It's a little off.
Maybe a little
Maybe
flat.
mentally.
We're not talking about position.
Oh, no,
Be nice.
That was nice.
that was, I was going to say that was nice.
That was me.
Okay, so the articular pillars, so the SCM is going to come from the clavicle and the sternum and comes to the mastoid process. So it kind of covers some of the articular pillars here. So we have to kind of push that tissue up and forward, okay? And then you're going to slowly sink. You're not going to go push like that because it hurts. You're going to slowly sink, and then you're going to use your middle finger or your index finger, okay? And you're going to go down the posterior part of the articular pillar and see if you can feel the bumps and valleys,
Okay.
okay? So I'm slowly sinking, I'm on bone, and now I'm trying to say, can I feel the bumps and valleys of the facet joints? Okay? Then I can move the SCM out of the way, and I'm going to come anteriorly. So now I'm coming anterior on the articular pillar. Okay? And then transverse process, and then I'm going to come posterior and palpate. Right? So when I'm finding these, I'm not looking for pain provocation. I'm trying to identify the articular pillar so I can do my upglides and my downglides.
So they're subtle.
Because they're subtle. Okay? Okay? Everybody clear on that? So find your SCM. Your scalene muscles sit deeper to the SCM. If you want to find them for sure, they attach to the transverse process of around C3, C4.
C3, C4,
Okay?
C5.
So if I have them do a big sniff, okay, they'll pop right up in your fingers. That's when you know you're close to the articular pillar. It's not one of these. It's, right? It's an abrupt sniff that'll activate the scalene muscles. Okay? So we're going to be at C3, and we're going to try and get down to C7, C6, C7. So as I come down, my articular pillar does that. Not so extreme. It does that. Right? Because it's transitioning in the thoracic spine. Okay?
So if you go like posterior to the like sort of kind of mastoid, and then what? Move the scalenes kind of like.
So the scalenes are attached to the transverse process, right? The anterior tubercle, transverse process, and posterior tubercle. And so you're just trying to palpate those joints.
Sink in.
Okay?
Into it and sink.
Yes. Right? So you need to be, when you're doing this, you need to be quiet.
Oh, do it.
Doing it, and you need to feel it. If you close your eyes, you will feel more.
Wow.
But if everybody's talking and goofing around, you will feel nothing.
Yeah.
Okay?
Complete a system.
So I want you to really work for the next 5 minutes, probably 10 minutes to the end of class, each one of you, finding the articular pillars. If you cannot find them, then you need to call one of us over to help you find them. Because you can't do upglides and downglides unless you know where the joints are. Make sense? And I don't think you kind of know, but I don't think you quite know. Right? That's on us, right? Fair?
They're here.
Right? They're there. So now, yes, in the neck.
They're there. I don't know if I know how to find it.
So now I want you to practice that. Like, remember C1, the transverse process is going to be way out to the side. It's just right off the mastoid process, inferior medial, and it hurts, right?
Yeah, it does.
Yeah, it does, right? So if I'm finding C1 transverse process, I'm coming off the mastoid process. I'm coming slightly inferior medial behind the SCM, and I'm pushing right there, and it's painful. Okay? And then from there, I can move down to C1, C2, C2, C3, but I don't want you doing that yet. I just want you finding the articular pillars. You can work on this specificity on your own time.